The first walls that are going up are in the women's outpatient center. We'll also have 3 wards that are just dedicated to women's inpatient care, in addition to several ORs that are going to be doing just GYN-related surgery. The earthquake was tragic, but we have a new opening and a new opportunity to do things very, very differently. And we're starting right here in Mirebalais, which is a clean slate. And when you think about research, service, and training, the 3 things that we link very heavily, we are using this as an opportunity to, from day one, kind of have those intertwined. Specifically around medical education and nursing education. We're building this hospital to accommodate teaching rounds. None of our other hospitals can really do that. We're building this hospital, the 2nd floor of our hospital, to have seminar rooms with high-speed internet for our students here, Haitian medical students and nurses, to be able to upload a video and watch a video from a lecture at Harvard Medical School right here in rural Haiti. As Partners in Health expanded in the Central Plateau, La Colline, Boucancare, Conge was already there, Belladère, the people, the denizens of Mirebalais, felt that in order to get quality care, they had to go outside of their own city. So in November of 2008, we officially were asked by the Ministry of Health to fill the void, and we responded in kind. We're going to have modern sterilization facilities for our 6 operating rooms, 6 being the most operating rooms in a public facility in the country. We're going to have digital radiography, again, not available in the public sector, but doing it in a way that is responsible insofar as making sure we can maintain what we're doing. And that's always, we have to walk a fine line, because we can't put systems in place that are incredibly novel in terms of a technology point of view that in 3 months then break down and we can't service them. The cholera treatment center prior to cholera was a barren hill behind the hospital that essentially collected a lot of garbage.
Nous avons 3 solutions que nous faisons ensemble avec lui. La première solution, c'est 001. Lui-même, il servi ensemble avec lui pour nous laver les mains. Et nous avons c'est 02. Il a fait nous lever les pieds, pour capable de piquer les pieds.
Because the Central Plateau is one of the epicenters of the outbreak, we were seeing hundreds and hundreds of people per day, so we needed to act quickly. Right now, we're in an epidemic phase of cholera in Haiti. It usually follows a predictable course of becoming endemic. Therefore, we expect cholera to be here for a long, long time. So we're going to have to think critically about a permanent structure or a semi-permanent structure that's not a tent camp, but real infrastructure to accommodate our cholera patients. But it's such a contagious disease that we really have to isolate those patients, and they can't even really be seen in the hospital, or else we risk contaminating people who come in with medical conditions that aren't cholera.
Et si on machine vient ensemble avec un choléra, c'est avec solution 02 ça, nous prenons nous fait tout arrangement possible, nous désinfecter machine et pour machine capable aller sans choléra là-dedans.
We have grown, and through our growth and through our experience are now ready and primed to responsibly and adequately build a facility of this magnitude. Certainly the earthquake changed our plans and really had us rethink what we were planning on. But Partners in Health has built a state-of-the-art facility in Butaro in Rwanda, and this is our next and newest and brightest flagship hospital. I can't think of a better way to serve the poor than to create a modern, state-of-the-art medical facility where you're not going to have to leave the island of Hispaniola to receive cardiothoracic surgery. You're not going to have to leave the island to receive complex orthopedic surgery. You're not going to have to pay, become further indebted to get an echocardiogram. All these things are going to be available right here in Central Haiti for the people.